Hello everyone, I'm Harirpoush, a master's student at Concordia University, and today I'm going to present our paper titled Virtual Reality-Based Preoperative Planning for Optimized Trocar Placement in Thoracic Surgery, a Preliminary Study. Lung cancer is the leading cause of cancer-related deaths and the second most common cancer worldwide. Recently, minimally invasive surgeries such as video-assisted thoracic surgeries or VATS used as a treatment option for the early stages of this disease due to having a shorter operation time and hospital stay. In this type of surgeries, usually small incisions called trocars will be used, one for the camera to provide a view of the surgical area, and two for the surgical instruments to access the surgical area and perform the procedure. Despite the availability of general principles such as baseball diamond principle in trocar placement for thoracic surgeries, surgeons mainly rely on their experience and patient's anatomy to place these trocars, which could lead to a suboptimal trocar placement. In this type of placement, the instrument's maneuverability would be limited, which could require the need of a relocation that could not only increase the invasiveness of the surgery, but could also prolong the operation time and add more surgical team fatigue. So, to address these challenges, we propose the virtual reality system to optimize the trocar placement preoperatively. Our system employs two steps, with each step incorporating specific interactions and data visualizations to optimize the plan. We further evaluate the usability of our system in a task of trocar placement for a right upper lobectomy. In the first step, the pivot mechanism guides the trocar placement for the surgical instruments by incorporating two spheres. This process consists of two main actions. First would be to select the endpoint near the surgical target, which has been visualized as a pin sphere, and then selecting the entry point on the skin surface. During this process, due to the safety concerns, it is important to place these entry points in a way that the tool's trajectory path doesn't have any collision with the vital anatomies such as bones, and to ensure the visibility of the instruments to the surgical target, it is important that the trajectory depth align with the maximum working length of the instruments. So, to provide the further assistance during displacement, we also include a real-time visual feedback by changing the color of the spheres and the trajectory paths. After confirming the entry points, the manipulation angle, which is an angle between the instruments when they meet each other at the surgical target, will be computed and shown as a feedback to evaluate the quality of the placement. Previous studies have indicated that the manipulation angle between 45 to 75 degrees could increase the instrument's maneuverability, which could facilitate the procedure. In the next step, a virtual camera needs to be placed within a chest area in a way that its optical axis points toward the surgical target. This would not only ensure an optimal view of the surgical area, but it would also maximize the camera's field of view with instrument's working area. Using a hand-grabbing mechanism within this step allows the user to directly control and adjust the camera's position by using the controllers. During the placement, we provide the visual feedback by changing the color of an optical axis to provide a further assistance in a valid placement. After confirming the camera placement, the overlap between camera's field of view and instrument's degree of freedom will be computed and visualized. We evaluated our proposed system in a user study with 20 participants. The usability of our system was examined through an SUS questionnaire, while we use a customized UX questionnaire to evaluate the user satisfaction, received usefulness, and the specific features of our system. We also gathered quantitative metrics such as task completion time and manipulation angle to further examine the performance of our system. The results of our user study indicates that our system achieved an SUS score of 81.8, which is significantly higher than the usability threshold of 68 and classified our system as A, which reflects its strong usability and user-friendliness. The UX questionnaire results also indicates the high user engagement, satisfaction, and perceived usefulness, with all of these items have an average rating range from 4 to 4.65. And the quantitative results of our user study showed an average completion time of 3.7 minutes, with 75% of the participants making no adjustment to their plans, showcasing their high confidence during the planning with our system, and other quantitative metrics such as manipulation angle aligned with the range suggested by the previous studies. At the end, I'd like to thank everyone who contributed to this work and thank you all for your attention. Thank you.